attending to the healthcare workers as a priority. They're our last line of defense, right?
Yes.
Hospital workers are the last line of defense. Hello, welcome back again, everybody. Happy Friday, April 17th. Big day today, all kinds of exciting things, but let's get to our news first. So, the number of cases in the United States, as we're tracking, 653,000 yesterday, now 690,000, still going up. We had that big spike yesterday, now 35,900. Still rising quickly. Straight to Marion County cases yesterday. This was from the night before, I think, right? So 106, and now today at midday we're at 115. Deaths remain at 3, and hospitalized numbers. This one was actually down to 7. So one more. Again, the number recovered is still at 0. I'll give everybody an example. We had a patient who called. He's a confirmed positive. He was tested originally on March 21st. They believe that he had been infected originally maybe somewhere around March 6th or so. He had traveled in-state. Even though his illness began sometime around March 21st, March 20th, March 21st, something like that. Here we are a full month later and he's still having some symptoms. He was wondering when he should get a swab again to confirm that he's recovered. And again, you have to be symptom-free for 2 weeks and then we'll re-swab to ensure that the virus is cleared out of the system. So it's again difficult to get recovery data. This number will remain 0 for a while. We're only about 5-6 weeks in our area for people that have tested positive. In fact, our first positive case was on March 20th, so it hasn't even been a full month yet since our first positive case in Marion County. So we won't have recovered numbers. This is going to stay 0 most likely until the end of April or beginning of May, but we'll leave it up there. A reminder, we are a donation site still. We're always looking for gowns, face masks, and shields. Hopefully we'll be using those at our drive-up test site very soon. We'll update you on that shortly. Also, basic supplies for the homeless. Looks like we got a donation here of some different items that people brought. A bunch of bags down here. We're going to make sure that we get that over to Interfaith and the homeless. We do appreciate those donations. Anything that you can bring, every little bit helps. Our testing sites remain unchanged. I did want to mention one small update. Express Care of Bellevue has just received a large quantity of test kits, and so they can now do drive-up testing at higher volume. So if you're down in the Bellevue area or even want to head down that way, they should be able to accommodate a pretty good number of people. Heart of Florida is doing a lot of testing as well, and Marion Oaks and Rainbow River is still doing high volume as well. Our testing site for Trinity Clinic, particularly to attend to those healthcare worker needs like we've already mentioned. We are very close to having the lease on the testing site signed so we can get that up and running. We're still waiting on insurance liability stuff, so that takes a little bit of time. Hopefully they get back with us by the end of the day today. Otherwise it could be Monday before we're really able to get gearing up on that. We're very eager to get that up and running. All right, straight to our flatten the curve. And we're liking what the curve is looking like today, let me tell you folks. Okay, so I promise next week I'm going to do this in the correct order. So this is Monday, Tuesday, Wednesday, Thursday, Friday. So we're down to 439 people admitted in the hospital. So I'm going to have to draw the shortest line yet. We're going the other direction with our curve, folks. It's a good thing, something like that, roughly. So that's the smallest number we've had so far. In other words, the fewest number of hospitalizations in one day. ORMC is down 174 people admitted, and so they discharge a number of people overnight. And of course, as everybody knows, we're looking to keep this as level and flat as we can. We don't want it to spike up here around 1,100 capacity in our county, so let's keep it in the 400s. That'd be great. Still a relatively small number hospitalized. Our cases are increasing. Our cases will continue to increase. That is a little more than linear growth. It's sloping upwards slightly. So in the coming 1, 2, 3 weeks, our cases in our county are going to continue to rise. We do not want to spread now at this point. You know, we've been dealing with this for over a month. We're all pretty tired of it. I'm pretty tired of it. I would love to go back to my regular life. I know everyone else would love to return to their regular life as well, and we're not quite there yet. We still have a few more weeks of hard work ahead of us, and at minimum of a few more weeks of significant and strict mitigation measures. Another thing, I'm asking anybody in the community that may know if there are companies that are operating large facilities where the employees are in close contact and they don't have the protective equipment that they need, maybe masks or gloves, anything basic. So if anybody's aware of any businesses, large businesses or facilities where large groups of people are congregating or close contact with each other, and if there's something we can do to help those businesses to have safer mitigation measures, please let us know in the comments or message us, and we're going to see if there's anything we can do to help those businesses to do a better job with mitigation. We must do it. Now is the time. We cannot get lazy. Another interesting thing, I just spoke with a laboratory based in Texas. Their Attogene is the name of the company, a molecular diagnostic lab. They usually do other things, not coronavirus, but they were able to produce an antibody kit and a PCR swab, and they're just getting that up and running. And so we may engage in some research with this particular lab right here in our clinic, see if we can validate that as a good, useful test. They're also going to be giving us some very interesting insight into what the FDA emergency use authorization process is like. So I hope to bring everybody some information on Monday about what it's like to deal with the FDA and what the requirements are to obtain emergency use authorization. So that should be a very interesting exercise. We're hoping to have that ready to go on Monday. We'll keep you posted. What else? I mean, we're really gearing up for the test site. This is the thing that we're waiting for. So a lot of our energy and focus is on that, and a lot of our energy and focus is on obtaining the fingerstick antibody tests. So the work from the past few days remains the same. We're getting closer on all fronts. Next week should look and feel like a very different week if we can get the test site up and running like we're expecting. So as we officially close out now our 25th update, although I don't think we started with updates right in the beginning, but this is now our 25th consecutive episode of running Inside the Clinic. We've had a great time doing it. We're very happy to be able to bring some information and insight into what's happening behind the scenes with the COVID response in our county and how these groups of doctors are working together. Ooh, that's another thing that I should mention. That group of doctors, the 200 doctors, you know, that we're working on. So this group of doctors is now very close to formalizing. Hopefully we'll have that completed by this weekend. And the name of this group is the Marion County COVID-19 Medical Task Force. So this document of a statement of intent and recommendations should be finalized by this weekend, ready to go for release out to the community, the public, to our local officials, health department, businesses, and the citizens of Marion County. We should have that document ready for consumption by Monday, so we're very eager to get that out. Yeah, forgot to mention that. That's a cool thing. All kinds of action happening. Oh, we also have that live webinar Monday with the CEP, the Chamber of Economic Partnership, Marion County Chamber and Economic it's the CEP. So we have our live webinar with the CEP and Mark Lander on Monday. There's going to be a Q&A session at the end of that. So we invite you to come and watch Monday at 2 o'clock. And I will be broadcasting in this Zoom meeting right here from this room, so we can use this board and let everybody know what's going on Monday. So we're excited about that too. Our sincerest thanks to everybody that's been watching and following along on this journey. Here we are 25 episodes in. We're so happy to be able to bring you this information and insight as we learn it. We believe that the more you know, then the less stress you have to feel about all that's going on. There's a lot of people working hard on this, not just us. Lots of docs, lots of nurses, ARMPs, PAs, they got their lives on the line right there as our last line of defense at the hospital. So let's protect them, let's be safe. We got a little while to go still, so hang in there. I know this is hard. I know we all want to get back to our normal lives. I do too. We're not quite there yet. Cut. Let's roll tape for Friday. I'm ready to go home.
That's about his wife.
Okay.
So I spoke to him yesterday.
Yep.
She had a cough. Her fever was kind of going up and down and staying in the hundreds. It's not going below that.
Yep.
They just called now and she spiked a fever of 102.7.
100 and what?
2.7. She's coughing and she feels worse.
Okay. So she needs to be tested. So we'll get to her
Bring her in
Monday?
Monday.
Yep. We'll get her in first thing Monday, isolate over the weekend. How long has she been sick?
I told today's day 4.
Okay, so
I think Monday.
by design, you can let them know that specifically I want to wait till Monday so we can get the most accurate result.
Okay. All right.
Awesome. Okay, so here's what we have going on up here this morning. Real busy. We got a bunch of cars in the parking lot. So we got a lot of action. We got swabs. This is a doctor out here that works in one of the hospitals, attending to the healthcare workers as a priority. They're our last line of defense, right?
Yes.
Hospital workers are the last line of defense.
The community is on the front line.
The community is the front line. You can't say it any better than that. So we're just a small business. Our revenues are down just like many people's revenues are down, although we're not complaining because we're still open and we're still here, but we're applying for this SBA loan that the government is authorizing just to help to keep us afloat while we're operating. And they're over here working on this right now with the bank. They've been working on it for like 3 days. And yesterday the headline was that the government ran out of money. This is what the stress of business looks like. SK and Deb, business manager. They're sweating the money. Okay, so we're working on getting our test site up and running, as everybody knows. And we need liability insurance. So I'm here to get an update from Deb for the first time, episode 25. You get to update me on what is happening with our liability insurance as of now for the test site.
The lease has been forwarded to Melissa Simmons at Lassiter.
Awesome.
That's who I spoke with this morning.
Good, they answered finally.
Yes.
It took you forever to get them on the phone, right?
And they have it, and they're processing it.
Okay.
So I will probably not have any more news till Monday. After she.
Can you get her on the phone for me?
Sure. I can certainly try.
Please do that. I'll explain to her a little bit more about what it is this is for and the urgency that we have. Because once I have a quote, then I can sign the lease and I can start working on the site. Not operating the site, but they'll let me go in and start moving stuff around. Got Ange looking for antibody kits from anywhere.
Okay, all right, Megan, thank you very much. I appreciate that. Have a good one. Bye-bye.
That's cheap, but not available.
Yeah, but look, it's the same exact one.
Oh.
That you told me that.
Yeah.
I'm trying.
Yeah, great.
Yeah, but they
I'll
don't-
take. Oh,
No.
they don't have them.
They don't know.
Are we done with swabs for today?
We done.
Okay.
Don't get any names.
I don't know.
He said he sent me face shield.
He did? Oh, I don't
Told me
know.
that day.
Actually, I'm not even sure if it was his son. Do you remember what he said? Did he say it was his son? I see no evil, hear no evil. That looks like a love affair with a donut if I've ever seen one. Jeez. I hope you got a little of that. Oh, we just got to.
My favorite one.
The price gouging.
Fucking price gouging.
There it is. Get me fired up about this. All right, everybody listen up. So we ordered these test kits. These are the antibody kits, which are gone. We ordered a few boxes of these. They were about 15, 16 bucks per kit, our cost. Then we ordered from the same company and they sent us a different box of kits. People remember the kits that were made in China, but they seem to work.
Shirley tripped and I couldn't help but
Oh, and then Oh boy. And so then we tried to order more of these kits that were made in China, and the company says, sure, you can order more. We need you to prepay because we don't have any, but we're getting more in next week. And they doubled the price for the China kits. They doubled the price just because the demand is so high.
It's like almost $40 a kit now?
For these from that
them.
company. So I can get these same kits from other companies, hopefully. Angela's working on it now. So not only that, there are doctor's offices that are charging
I saw $250.
$250 for tests.
Taking advantage of people.
Price gouging, taking advantage of fear.
Saw a doctor's
There is
office
very
for
little
$5.
that pisses me off more than someone who's going to take advantage
Not right.
of the situation that we're all in. It's like everything I can do not to call people out by name.
You should eat a donut.
I should eat a donut.
Yeah, makes you feel better.
Your diabetes might
I feel
flare up.
so much better now that I ate a donut.
You do? How long is this happiness going to last?
Until the chocolate wears off.
How long does that usually last? Like
I don't know.
4 or 5 minutes?
I think we can push it to like 20.
Oh, that's pretty good.
I digest.
That must be good chocolate. Is this refrigerated from Henry Schein?
Do not freeze.
It says do not freeze and it's in a freezer? That makes a lot of sense.
Oh, I know. Nothing surprises me anymore.
We can refrigerate it but not freeze it maybe?
Here.
They don't make it easy, do they? Ugh.
Haha. What are you? IgM.
Oh,
Oh,
we got some more antibody kits.
So that's perfect timing.
They weren't even supposed to ship these until... Hey, can you grab Ange real quick and have her run up here? Don't tell her why. It's an emergency. These weren't even supposed to be released until May. She talked to him yesterday or the day before. What the heck? Oh, that's wonderful news. That buys us another few days then. So it is extremely difficult to find any COVID antibody test kits now from anywhere at this point. Certainly not the 3 FDA emergency use authorized kits. Those are a no-go.
There's 2 separate. There's the IgG.
IgG and IgM, I was worried that they'd separate it like that.
It's an emergency!
And what-
It's an emergency! What the
I
fuck?
thought these weren't even supposed to be released until May. How did we?
Surprise! Okay. What is this Henry Schein for real?
Yeah,
Well, remember that label?
Henry Schein antibody kits. IgG, IgM, but from Henry Schein.
When that lady told that lady, whatever day she called, and she went.
Now these are probably pretty good. God, they got like the packaging all printed up.
No, these are
So
the-
IgM cartridge and an IgG cartridge. So we got to do both. So here's 20 more then.
Now, these are the FDA ones,
No.
right? No?
No,
Oh, really?
not yet. Maybe one day, but not yet. There's just the 3 companies. Hey, this is manufactured by SD Biosensor.
That's one of the people that's on my list right here. On my list already. I've already tried to do that. Don't worry, I got them too. And then the other part of the Biomedomics and the SD, that's another one that halted all orders that I got a hold of on 4/15. So any future orders that you try to do directly through them, if you weren't pre-ordered, they already halted any new. Like if you try to go directly to them.
So this is the last box of this we're gonna get for a
From
while.
Henry Schein, yep, and then, because remember they were going to this part from someone else,
Yeah.
but that's not till May 1st.
Wow, it's weird that we even got these in, but we're now rationing antibody
Those
kits.
are the original ones that were supposed to ship out, remember, starting the 6th.
This is one of the very first ones we ordered,
Very first
like 2-3 weeks ago.
Yep.
And here we go. So it took us 3 weeks to get this little box of 20 kits in.
Yep.
How much was this box? Do you remember?
$660.
$660
Of course I remember.
for 20 test kits. So these are $33 a pop. Okay, well,
Let me see them.
look at that.
So it's 2 separate. the
It's IgG and IgM separate.
Yeah, separate.
Right.
Why are you making that face?
Yeah.
At least we got something. So we've got these, plus this, plus, do you have any anywhere? You have a few sitting back there, 3 sitting back there, a few here, these, and there's a few of the other ones we got stashed for double secret that only me and Ange know about.
You You don't know where they are.
I don't even know where they are actually, but yeah.
Double secret.
So if Ange gets hit by a
Getting
bus,
low, so nobody.
if Ange gets hit by a bus, then we'll never find those kits.
I got backup. There's one person on top of me that knows.
I am really surprised. I didn't, these weren't even supposed to come. That's so strange.
So they did like
Stay there. You have to back up a little bit and get on your X.
Where's my X?
I don't know, it's somewhere right about there.
I see what you did. Okay.
See what I did there?
I see what you did there.
But your hair is, well, set this box and then we'll have to watch the video later and see which way the box is leaning on who's taller.
Gotcha.
So right now the audience knows before we know.
Yeah.
Honestly though, this is our 25th consecutive episode
weeks.
that we filmed together.
5 weeks.
Did you ever think we would be able to do anything for 25 days in a row?
I'm surprised we made it to day 5.
Yeah,
Probably.
until we can guarantee immunity.
Immunity. It's
Yeah,
Nothing
so
you can do,
it's
really.
either herd immunity,
yeah.
but I don't think that's a good choice for a virus that's as deadly as this one. It'll be a year
So
on a
we're
vaccine.
gonna have to, because we can't close for a year, so it'll be left to our own devices for the next 11 months.
Do you trust the people?
I trust some people.
I trust some people
I don't
too.
want to get coronavirus, so I'll stay inside.
I don't want it either. So hopefully the people that we can trust to do the right thing will teach the people
Who
aren't doing the right thing. All right, so let's close out Friday, 25th episode. You know, there are TV shows that haven't lasted this long.
Yeah, 5 weeks, yeah.
We've done 25 consecutive half-hour episodes. There are TV shows that didn't do
That's
that.
like 2 full television series, like seasons.
Yeah, where's Netflix?
We should go get it.
Hey, we need you to call Netflix. So if you had a YouTube channel, how would you close it out? Like if you had a gaming channel, how would you close it out? How would you close it out for a bunch of 11-year-olds?
They used to seriously ask for likes and subscribes and all that type of stuff. Now it's all satire. Like, so that's a joke. So now, like in the middle of the video, they're like, "Yo, we're gonna go for 7 million likes. We need 7 million." Or you go like, "We need 5 likes." They have like 20 million subscribers.
Oh, somebody's putting something together for us? No, that's awesome.
How about that?
Thank you, everybody. Thank you for the donations. Thank you for the donations. Okay, so close out the 11-year-old. We don't care about likes and subscribes, or
Yo, can we get 1 share on the video?
all right, let's go for 1 share.
If we can get 1 share, we're famous.
That's it. Happy Friday. Nobody's home.